degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines, we have it all. At RadMed, we are dedicated to revolutionising healthcare. We are experts in radiology and healthcare equipments, serving all areas in Kenya. In Calvary Hill Hospital, we delivered installed an X-ray machine with a CR. In Ziwa Hospital, we delivered and installed an X-ray machine with a complete CR. In Mwanzawetu Health Services, we delivered and installed a colour Doppler machine with 2 probes. Brooks and Cherith Hospital, we delivered and installed an X-ray machine with a CR. In Nanyuki Hospital, we delivered and installed an X-ray machine. Esobi Healthcare. Malkia Wings Hospital. Zenit Care Hospital. Nelly Nursing Home. Pro Care Cottage Hospital. Esther, a radiology entrepreneur. Itak Hospital. Peter, a radiology entrepreneur. Mugamo Medical Centre. Jabs Medical Centre. Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines, we have it all. At RadMed, we are dedicated to revolutionising healthcare. We are experts in radiology and healthcare equipments, serving all areas in Kenya. In Calvary Hill.
Welcome to Medicwise TV. Today we are privileged to have a special look at the regional practice in terms of echocardiography. So this is Medicwise TV. You are having for healthcare discussions. In Medicwise TV we say our aim is to inspire, educate and inform. So feel much welcome, our viewers. And on set we have none other than Caroline, a very vibrant, passionate echocardiographer in this country, Kenya, practicing widely. And apart from being an echocardiography specialist, she is also an educationist. She has passion in teaching the same subject, the same practice of echocardiography. And it is this opportunity I'm going to give her to introduce herself. Welcome to the show, Madam Caroline, first of all.
Thank you. Thank you, host.
And this is the time to introduce yourself to our viewers. Many of the people may not be knowing exactly who is Caroline. So please feel much welcome.
Thank you. Thank you very much, host. Greetings, viewers. My name is Caroline Chepkemoi, as you have heard. I'm a registered cardiac sonographer. I'm a medical educator, and I'm also a radiographer. In my daily duties, I perform echoes. I do echoes and interpret them to aid in diagnosis of the cardiac structures. So thank you, welcome.
Straight to the first question in this conversation. What is echocardiography? Because the people looking us, watching us now, we don't assume all of them are radiographers. There are quite a number of medical professionals watching us. So what is echocardiography? Assuming you were to explain someone who is a layman.
Thank you. So echocardiography is cardiac imaging, or in the layman language, ultrasound of the heart. So basically it's using the sound waves to evaluate and to visualize the heart. With using the sound waves itself, it's a non-invasive modality. It's a modality that can be done in any setup because it does not require any specific preparation or any specific setup. So echocardiography is a field that is that is more advocated to be performed to each and every person who is in need, or who, mostly even the patient who are hypertensive, diabetic patients, and the elderly patient, even on the kids. So echocardiography, basically, it is the study and evaluation of the heart.
Wow, this very nice detailed explanation there about echocardiography. However, let's know, what is this your basic training, or you had training in other areas? And take us through the journey of you becoming passionate in echocardiography. How did it start?
Thank you. So as I said, basically I started training as a radiographer. I'm a basic radiographer. Then with the passion and the interest and the fascinating on how the heart looks like, that is where I was drawn into pursuing the field of echocardiography. So with that, having the involvement of the technology, improvement of the technology, use of AI, and the involvement of the ultrasound being from the radiography field, that is what drove me to really want to know, what is this echo? What is the science behind it? Why do we see these images? How can I be also part of the team that helps in the diagnosis and helping in the management of the cardiac issues, or being part of the team that solve the cardiac problems that we tend to come across during our daily practice.
And for how long have you been practicing specifically echocardiography? You have said your background is you are a radiographer. When do you enter officially to practicing echocardiography?
For the echocardiography, I would say I've practiced for quite some time. At least I've been in the field for quite some time, and I would say I have an immense experience in both the technical part as well as in the clinical knowledge, as well as in the part of the patient care and how to really interpret those images keenly. So I would say I have a good experience and a good time in the field, yes.
Well, that's so good. So let's come to the echocardiography practice in Kenyan context. When you started, was there formal training on echocardiography? Because we understand when you are a radiographer, we train normally the normal diploma or degree, you graduate. Then, did you get formal education anywhere?
Yes. So for sure, when you train as a radiographer, and the radiographers, those who are watching, can bear me witness that there is a section or a unit in radiography that deals with echo itself. So apart from that, that is just a basic knowledge for you to know what revolves around sonography. So with the training setups and the institution, yes, there are several training institutions, and depending with the one that one chooses to go. And again, I must say that by choosing an institution, it goes with the passion, it goes with the interests, and it goes with the drive as to why you really want to do the echo. Because I'll say all training institutions have the passion and interest in giving their learners their best, trying to meet their learners' objectives. So I'll say yes, there are some training institutions in the country that are offering the echocardiography course.
And maybe Lana, maybe people watching you are very much interested to pursue the echo route or echo practice. Maybe it's important to mention which are some of the few institutions in Kenya training echocardiography, and how long is the training?
Okay, thank you. So as with the training institution, each and every institution have their own program. They have their own setup on how they want to train their learners and how much they want to equip their learners. So one that I will say that I'm really conversant with, that I interact with most of the students, I'll talk of the Kenya Medical Training College. That is the campus that they offer the training. And as I said, with the institution, some institution will train for a period of 3 months. Some institution will train for a period of 6 months. As I said, with each and every person, depending with your interest and the passion, that is the one will choose the institution that they will want to train under because of what they are going to achieve. And in relation to again the tuition fee, remember it is not just a free course. So all those factors are factors that individuals tend to factor in as they choose an institution to train. Yes.
Caroline, many people argue that echocardiography is a field for cardiologists. What is your view on this one?
Wow. Yes, as they said, it's for cardiologists. Remember, again, there is an instance that they will say radiology is for radiologists. So as we say, cardiography, echocardiography, we also have cardiac sonographers, cardiac physiologists, they call it in other institutions. So no, it's not really specific for cardiologists, knowing that cardiologists, they have a lot of work to do. They are broad, so therefore it's not really narrowed, or it is not really specific to the cardiologist. Cardiac technicians, be it the radiographers or be it any other training, depending with the training institution and what they allow and the requirements for the to train the requirements for the trainees, really is a really very crucial role. Cardiac sonographer, yes, it is also still a role that really needs to be embraced, and it is also a role that is not really for cardiologists. And also just to mention to us that with the cardiologist, we'll tend to really put it across to us that cardiologists, yes, they are cardiologists. They have specialized, they do in the management field. But again, they will find that in their institution, they also have the cardiac sonographers. So cardiac sonographers are not specifically for the cardiologist. Just the same way radiographers, they are not just there for the radiology is not just for the radiologist. They also have the hands-on persons, the people who are really important in the field, the technical people who are the radiographers. Yes.
So in a nutshell, you are saying, other than radiographers practicing echocardiography, we have other people from other medical professionals like clinical medicine or nurses who have trained in echocardiography. So it is not exclusively a field for sonographers or radiosonographers in this sense.
Yes, for sure. If you see most of the training institutions, they have opened that field, that room, that any person who have trained from a medical institution, that is clinical officers, the radiographers. You also find radiologists still training as the echotechs. You also find medical officers. You find the clinical officers. They are those who have specialized, the anesthetists. They're still coming back to train as an echotech. So it is not really a structured, it's not really a system that is really confined to only radiographers. So it is a field that is broadly being embraced by these other departments.
We have regulators, you know, boards, councils who regulate every practice. So you can say echocardiographers are regulated by which body?
Good. So as at the moment, there is a field that there is a team that is on the ground that are working on the on really streamlining and having a regulatory body. Having said that, all these persons, the clinician, the nurses, all of them are under one umbrella. They go for training and they become the cardiac sonographers. So there is a body that is in the, there is a team that is in the field trying to bring about a body that is going to streamline to have one, the echocardiographers under one roof. Just the same way the radiographers or the nurses have their nursing council, radiographers having their societies. Yes.
Good. So once one is interested in pursuing career in echo practice, what is this core training, areas which one needs to have strength in? I mean, what are the subjects or modules one needs to have strength so as to qualify as an echocardiographer?
Thank you. So as a trainee, and I would say this, and this cuts across all the medical trainings, that with the training, you're going to deal with human beings.
Okay.
So what lies cuts across is for ecotechs, just like any other profession, you need to really have a good background in anatomy and physiology to understand. If you are going to deal about the heart, you really need to have a good information. You really have to study what is this heart, what does it compose, how does it work. And in addition to that, remember that you're not just going to see the heart. You also have some technicals, skills that are needed there. In terms of the machine that you are going to interact with, you need to know about how do you get this image. How do you optimize this image? So aside from the knowledge on the anatomy and physiology, you also have to know about the technical skill in relation to the machine, the equipment that you are going to use. How is it? How are you going to get an optimal image? An image that when any other person look at it will be like, oh, this image is really good for diagnostic purpose. So and in addition to that, again, you are dealing with human beings. As I said, you need to have good patient communication practice. So you also have to have a good communication skills, because some patients comes in, they're anxious patients. Patients really are scared of what is going to happen there. So you really need to know how to really interact with that, with people, interact with the patients. These are sick people. You really have to have that kind of a good communication skills. Yes. Actually,
you have just hinted on what was going to be my next question. I was going to ask you now, when people are told that you need an echo, in other words, the doctor has hinted to the patient that you could be having a heart ailment, or your heart is sick in street language. So this is someone who must be so much worried coming to you, knowing very well maybe he's coming to be diagnosed with a heart problem. So do you find any challenge in practice dealing with this, basing it on anxiety and phobia and fear of the unknown?
Yes, thank you. So I would say yes, there are challenges in the field. There are challenges interacting with the patients. Remember, just like you have said, is that you're dealing with the heart. You're being told, go have your heart checked. That means there is a possibility that you will come out with a negative result.
Yes, yes.
So that anxiety, that worry of like, what could it be, is also one of the things that we deal with in day-to-day practice. And then again, aside even from that, you find it is the first time coming there. So those are the challenges that we come across. And how do we handle this? As I said, being a good ecotech, you need to have good communication skills.
Yeah.
Yes. So you need to have a way of interacting with this patient. Talk to the patient, give them proper instruction, give the patient instruction, take any question that they have, assure them. And then again, having told us that echo is an non-invasive procedure. So it means that giving that assurance to the patient, that even you are going to be in the room. You know, there are these other modalities that you have to leave the patients in the room, assuring the patient that you are going to be with them in the room. Those are the things also that will give them that confidence, that calmness, talking to the patient. At times, even you might be needed to talk to the patient about something that is outside the room. Just bring about a story, something that will help them to calm down. So those are the things that really, as a cardiac sonographer, and I would say I cut across in our practice, those are the things that you need to talk to the patient, assurity. And in a case that coincidentally, I'll say you find that there is an abnormality there. So how do you going to handle to the patient? So you also need to assure the patient, have the patient calm down. However, you might not really give the patient the full information of what you've seen, because remember, you are just a technician. There is a doctor. So you also have to calm the patient, assure them, and then you just release them to their doctors. Yes.
Wow, good. Now let's change the gear a bit and let us talk about technology.
Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines. We have it all. At RadMed, we are dedicated to revolutionizing healthcare. We are experts in radiology and healthcare equipments, serving all areas in Kenya. In Calvary Hill Hospital, we delivered installed an X-ray machine with a CR. In Ziwa Hospital, we delivered and installed an X-ray machine with a complete CR. In Moanzoetu Health Services, we delivered and installed a colour Doppler machine, 2 probes. Brooks and Cherith Hospital, we delivered and installed an X-ray machine with a CR. In Nanyuki Hospital, we delivered and installed an X-ray machine. Esobi Healthcare. Malkia Wings Hospital. Zenit Care Hospital. Nelly Nursing Home. Pro Care Cottage Hospital. Esther, a radiology entrepreneur. Itak Hospital. Peter, a radiology entrepreneur. Mugamo Medical Center. Jabs Medical Center. Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines. We have it all. At Nelly Nursing Home. Pro Care Cottage Hospital. Esther, a radiology entrepreneur. Itak Hospital. Peter, a radiology entrepreneur. Iwa Hospital, we delivered and installed an X-ray machine with a complete CR. In Moanzoetu Health Services, we delivered and installed a colour Doppler machine with 2 probes. Brooks and Cherith Hospital. Malkia Wings Hospital. Zenit Care Hospital.
A small technical hitch, and we had to take you for an expected commercial break, but fortunately we are back And just before we went on that unprecedented break, we were discussing about AI and its impact on echocardiography. So, Madam Caroline, maybe you can shed light on, is there, what is the future of echocardiography in terms of AI impact?
Oh, thank you. So, talking about the AI, that is, it comes in with the evolution of echocardiography, or generally the ultrasound.
Yes.
So with the echocardiography, I would say there is a massive revolution on the same. Like if you can take us back to 1950s, thereabout 1960s, there was the use of the technology. However, it was the M-mode in doing the echoes, M-modes. Yes, M-mode is a good mode of doing the study. However, with the evolution in 1970s, where we started having the 2D modes, now the Doppler came in. Now we are having the 3D and 2D. Now we are also embracing the issue of the AI, whereby we are also there are so many companies, companies that are coming up with the machines, yes, that are incorporating the technology, which is very good. I would say it is really plays a very crucial and important role. It has really improves on the diagnosis, better diagnosis of the cardiac malfunctions or problems with the heart. So in terms of you see about the AI comes about with the where we have the speckle trackings. Those are the things that are incorporated in some of the systems, yes, which helps in the diagnosis of the early detection of the myocardium or the function of the heart, which helps in the early management or avoidance of further damage or further problem with the heart. So I would say yes, technology, the AI is really doing a great job. However, it's not as far as we had at the moment. It will not really take up the human factor in the market.
In other words, it doesn't have the potential to replace a human being from practice.
Yes, yes, I would say it is really, it won't really phase out. It will have some, it will be like a catalyst and additives on how this human being will use the echocardiography in the evaluation of the heart. Yes, so it will just be an additive, like a catalyst in the management and diagnosis, follow-ups, and in the treatment of these, the echo, the hearts. Yes.
Now, let's go to diagnosis, and let's talk about what are these, with the advent in the 21st century, with the advent of many mysterious diseases. How is the heart affected? You know, what are these some of the most common conditions which you are diagnosing out there, in which you may wish to enlighten the community about what the impact on health is in terms of what you are diagnosing there?
Well,
commonly.
Yes. And commonly in echo, as I said, we are dealing with the heart. And when you talk about echocardiography, it is the study of the structure. How is the heart? How does the heart look like? Now, having in mind, having told us that as an echo tech, you have to have a good background on the anatomy and the physiology. Now, when you go in to do that echo, one, you need now to know how is this heart structurally. That is in terms of the size, the walls. Now come to the valves. How are the valves? Are the valves the number that is expected? Because there are instances that you will have more or less number of valves than the normal, the normal expected structure of the heart, in the heart. So again, when you have that one again, structurally, know about the structurally, how is the flow? As I said, the technology we have, the development of Doppler, the colors. How is the blood flowing? How are these valves? How is there any communication? That is there any blood flowing from the direction that is not expected? Is there any defects, the cardiac defects in the heart? So those are the things that really, with this technology, it really help us to get to know. Talking about the issue of the myocardium, the early detection with the technology.
Yes.
We have what we call, we have the speckle tracking, which are incorporated currently with some machines. So they really have to early detect the myocardium, this muscle, the heart muscles, how are they, and really try to curb or try to give medication or prevent any further damages. Another thing is when you talk about echocardiography, as I mentioned to us, is not really is really broad. We have this technology as well as is evolving. Apart from the speckle, we also have what we call transesophageal echocardiography, which also plays a very crucial role in talk about the diagnosis, early diagnosis. You have the valve, you're managing or you are doing a follow-up of valve. You do the normal transthoracic. There is a part of the heart, of the valve, that you're not really sure whether there is an abnormality or it is normal. So you really have to advance transthoracic, esophageal, which really you go in to the heart, closer to the structure, closer to the valve, whereby you will really delineate whether this valve is really damaged. How is it? Is there any other, what we call the masses there? So with the technologies, I'll say it is really helping out in the management and capping these diseases, the cardiac diseases. Yes.
Tell us about, in your observation, while in practice, what is the what is the age group which is most affected by heart ailments in terms of practice? Is it teenagers? Is it old people? Is it middle-aged people? Who are the most affected with heart problems?
Yes, I talk about the practice. The heart, I would say it's both the pediatric and the adult, the teenagers, they have it. However, the people who are really at the high risk, or the people who are prone, I would say they are elderly patients. Okay. However, the young persons, these are energetic persons who are up and about because of lifestyles, they are also affected by, they're also having the issues to do with the heart. So we'll say the age, the elderly person, we'll talk about from 45 onwards. Those are the people that we really also advocate for the screening. That is why we have annual cardiac camps, whereby you have routine, have your hearts checked, get to know. If there is any other abnormality there, it can really be detected early. So the people who are really in the advanced stages, those are the people who are really advocated and really asked to really do the scans. In additionally, we also have people who have diabetic patients. We also have hypertensive patients. So it's not necessarily that you just wait for the symptoms. With the advancement with technology, you can easily pick whether if there is anything that is really advancing. So yes, with people who also have some chronic conditions, or people who are undergoing the treatment, like the radiotherapy, chemotherapy, those are the people also who are encouraged also to have the scan being done on them. Yes.
Young medical professionals listening to you who may be inspired to pursue echocardiography training, what general advice do you have for them in terms of their aspirations?
Thank you. So for persons who are really interested in doing the echo or pursuing the echocardiography, one I would say it should not be because others have done. It should not be because you've had people you're being pushed to do it. It should be because of passion, the interest, because you need to have knowledge. You need to have the technical skills. Addition to that as well, you also need to be informed, because technology evolves. So you need to be willing also to really go up and about, get to see, get to hear what is happening outside the world, what is evolving outside there. And I would say echocardiography still stands to be the crucial, plays a crucial role in as far as echo, or as far as the cardiac diagnosis is abnormalities are concerned. So I'll tell them that yes, with the technology, having the echo, it is a real-time study. It is a study that helps the clinicians to really see, get to know what is happening there for early detection, for management, for the follow-up, and all of this is with the non-invasive, is a non-invasive procedure. So yes, I encourage persons who are interested, who are with the passion, to go with it because population is increasing. People are needed outside here. So yes, go for the training.
Maybe also before we wind up, is it important for you to talk about, because you are a trainer, personally you are a trainer of echocardiographers, working with students. So what do you find any challenges the students have? And do you find that most students, especially radiographers, are ready to take up this course? And do you see uptake in the course being impressive, or people are shying off from the course?
Yes, thank you. I would say that the course is really and highly being embraced. And I would say, what I would tell us, and what I've just said, is that you need to have the passion, you need to have the interest. Remember that when you're going to train for an echo, you're not going to train it from the basic. You already have a basic medical background. This is a specialty that you are going in. So you need to have a personal push, I would say personal initiative throughout the training. And with that one also coming in with your own objectives. Those are also something also that should really drive one of the individual. So I would say the course is really being embraced, it's really being taken up, and I challenge all of us, the radiographers, the sonographers, being my origin, I encourage us to come in having in mind that all the other bodies now, the bodies, the nursing, the clinicians also are coming in. They are coming into the system. So I encourage us to really come in, embrace it, having the background of radiography or sonography. It will really be of great advantage of, to pursue the echocardiography course.
So maybe before we go before we give final parting shot, maybe you should tell us what is the future of, where do you see the future of echocardiography practice? Maybe in the next 5 years, what should we expect, especially in the Kenyan context?
Thank you. So with the kind of evolution in echocardiography and generally medical field, and I would say that going forward, being echocardiography being embraced, it's going to be really assimilated in most of the procedures, and it is also being used. It's also being taken in as one of the I would say the basic modality that is going to be embraced in most of the institution. And with the technology having the POCUS, the point of care machines that are being used in bedsides, in emergency setups, those are also, it's going to really be really massively being embraced and being taken. The technology is really going to broaden and widely take up, with most of the institution embracing this echocardiography. Yes.
This has been a very passionate discussion with Madam Caro here in the studio. Remember, this is Medicwise TV, and I'm your host, Didakus Mochache, aka Dida the X-Ray Man. We are here always to bring you this kind of discussions, this kind of guests, and this kind of quality work, so that you enjoy your viewing to us. So we would like to acknowledge some of our viewers who have texted us here on the studio. We have John Kibrangat is talking from AIC Retain. John Kibrangat from AIC Retain is saying, Caro, my echo teacher. So Mr. John Kibrangat from AIC Retain is acknowledging that you are her teacher. Do you know him?
Yes. Say hi to people from Retain.
Mr. John Kibrangat.
Say hi to the fellow there.
Yeah. Another one is saying very impressive, Madam Caroline. Collins Chumba is saying correct. AI enhances our ability to diagnose. So thank you so much, Collins Chumba, for being here with us. Please remember to place the subscription button there so that we can always be together here with these discussions. Someone is asking a question here, and someone is saying we should ask you a question. Someone is called Sam Kasmil.
The blood moves around the body, and also it passes the heart, being the engine. So when you go about, you get to study about the echocardiography, you realize that there is a communication. That makes us now get to know, have a clinical knowledge on, when you're doing the echo, have a clinical knowledge, because remember, if you have the vascular, say blockages or masses down there, they go through the heart. So we have what we call the embolisms. You have heard of pulmonary embolism, whereby you find the pulmonaries are blocked. So those are the things that really tend to have a patient being done for an echo, just to be sure that there is no debris, there is nothing that has really migrated from the lower part of the body to the heart. Yes, so it is one of the indications, and you should not really keep off the patient just because they have been diagnosed with DVT and they are being sent for echo.
Yeah, we hope Sam is answered. So more and more texts are coming in live, and we don't take this for granted, folks, for supporting us and giving us your opinions and giving us your suggestions. Please always remember to, if you want to have a question or you have to write a commendation or a suggestion, our WhatsApp number is on there on your screen. And important to note, someone called Kipsang Mutai. Kipsang Mutai says, nice presentation, Madam Carlo. Kipsang Mutai is watching you. Apparently, all these people are Kales. These are Kales. Yeah? What is happening? Yeah? Why is Kales? They are celebrating you so much.
Probably because the name ends
Monica
with
Cherangat
so.
is online. Monica Cherangat is also here. Nice one, big girl. Is saying Monica Cherangat. And then Felix Ochado. Huyo ni wa kutoka Nyanza bana. Huyo ndiye amekuja hapa ku neutralize ground. Amesema robust and informative, appreciated. So Felix, we are watching you and we are seeing you, your text, and we appreciate so much. Koskei Cliff, my good friend from Kericho, is saying, very impressive, my good friend Carlo, well done. Hey, people are really celebrating your echo talk this evening, and we really appreciate them back, and we love you people. Madam Carlo, tell them something. These people have written. Do you tell them something?
Thank you. Thank you for watching, and I'm happy that in one way or the other we have interacted, and wishing you all the best in your fields as well.
Benjamin Gidinch is also coming from Mount Kenya, representing from Mount Kenya. Benjamin Gidinch said, very nice. Gidinch watching from Nairobi. Gidinch watching from Nairobi. So Gidinch, we are very happy for your input and your text here from the studio, Medicwise TV. We come in strong. The messages are coming in fast and thick. And we may not be able to read all of them, but we appreciate you guys for your input. Madam Carol, now maybe you can give your parting shot. If your parting shot, members are led to hear. What do you have to finally say about this conversation of echocardiography?
First and foremost, I'd like to appreciate and be thankful to the host. Thank you for having me this day to talk about this important course or important specialty of echocardiography. I would say that echocardiography is really a field or a specialty that really encourage and really urge the persons to really have patience, have persons, have yourselves go there, be checked, have your hearts be looked into, well say so. Have it to really avoid the conditions whereby, the situation whereby you find a person really, somebody just sleeps and never wakes up, or somebody who finds somebody, most of the time this person have just swollen legs, unexplained chest pains, persons who really are really difficulty in breathing. Those are the people who really we encourage all of us to go in, just to avoid the disease, the progression of diseases whereby we could have really detect and pick it up in the early times. So I would say that for the people who are interested, people who have passions, people who really still fascinated about the hearts, I will ask us to go in, have the training, get the expertise, go there, deliver the services, and I know with the good job that you will do, with the good work that you will do, I know that the society also will embrace, and the institution also will really, really recognize and position us in a place where we need to be as a specialty. Thank you so much, and I wish you all the best. And good evening.
Well, we don't take it for granted for our guest to be here. So, Madam Carol, on behalf of Medicwise TV, I wish to extend my sincere gratitude and appreciation for being here. We don't take it for granted. We will always appreciate, and we wish that next time you come in, we have a different discussion in the same line of echocardiography, but a different discussion, maybe feature on the specific ailments and diagnosis like that. Okay?
Sure.
Benjamin Githinji is reminding me that you should have said Nairobi West Hospital College. Nairobi West Hospital College is offering echocardiography. Are you aware of that? Always, huyu jamaa analeta siasa hapa kwa studio. Benjamin Githinji is speaking, and Margaret Munga is saying very informative presentation, Madam Carol. So, from the studio, I was your host, Dida the X-ray man, aka Didacus Mochache. Dida the X-ray man is, sorry, I'm confusing. I'm your host, Didacus Mochache, aka Dida the X-ray man. Please remember this show is sponsored by RadMed Connect Limited, a company which supplies radiology equipment and supplies. Please don't forget to support us when you have clients outside there, those who are listening to us. So RadMed will be there to give you a 360-degree solution to your health care, to your radiology needs and radiology supplies. And from the studio, without much ado, I wish to say bye-bye and good
social media apps.
TV.
We have Facebook, we have Instagram. That is all we are requesting of you. Is that too much to ask?
TV.
Please help us grow.
This is Medicwise TV.
This TV, Medicwise TV, is one of our RadMed children, because we have 4 of them.
This is
And we are saying
TV.
that every time you subscribe to watch.
Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines, we have it all. At RadMed, we are dedicated to revolutionising healthcare. We are experts in radiology and healthcare equipments, serving all areas in Kenya. In Calvary Hill Hospital, we delivered installed an X-ray machine with a CR. In Ziwa Hospital, we delivered and installed an X-ray machine with a complete CR. In Mwanzawetu Health Services, we delivered and installed a colour Doppler machine with 2 probes. Brooks and Cherith Hospital, we delivered and installed an X-ray machine with a CR. In Nanyuki Hospital, we delivered and installed an X-ray machine. Esobi Healthcare. Malkia Wings Hospital. Zenit Care Hospital. Nelly Nursing Home. Pro Care Cottage Hospital. Esther, a radiology entrepreneur. Itak Hospital. Peter, a radiology entrepreneur. Mugamo Medical Centre. Jabs Medical Centre.